Standard 3.3 Survivorship Care Plan is a phase-in standard for 2015. It requires all programs to provide cancer patients completing treatment with a summary of that treatment and a follow-up plan going forward into their survivorship. Cancer Committee develops a process to design the care plan, distribute it to the patient, and ensure the patient understands its purpose and use. The process is monitored and evaluated by a designated member of Cancer Committee who presents the plan to Cancer Committee at least once yearly. A 2005 IOM report revealed that many patients completing cancer treatment were lost in transition after oncology care back to follow-up from their primary care provider. Cancer survivors were not educated on the possible long-term side effects of their treatments, vigilance about possible recurrence of their cancer, or what surveillance methods or screening should be employed as they moved into the survivorship phase of their cancer journey. A survivorship care plan is important for patients so they understand that monitoring their health with regard to a cancer history must be part of their lifetime follow-up. The care plan can provide important information to other physicians about possible side effect management, signs of recurrence, or second malignancies. To meet the standard, Cancer Committee decides on a format for the plan, either written or electronic. The plan must incorporate evidence-based standards of care for follow-up related to that patient's treatment. The appointed designee meets with the patient and clearly explains the purpose and use of the care plan. All methods used to create and distribute the survivorship care plan must be documented. A compliance rating will be applied if the Cancer Committee has developed the process for disseminating a survivorship care plan to the specified patients and documents the monitoring, evaluation, and reports yearly on the plan to Cancer Committee. There is no commendation for this standard. Cancer Committee decides who is to develop the care plans, share them with the patients, and report to the Cancer Committee. A nurse navigator may be best qualified to perform these tasks. The use of the IOM fact sheet, Cancer Survivorship Care Planning, listing the minimum elements for inclusion into the care summary, is a good strategy. The use of registry data may help in filling in treatment modalities. Evidence-based websites for the American Society of Clinical Oncology, National Coalition for Cancer Survivorship, and the Live Strong Foundation are good resources for care plan templates. Thank you for viewing this video on the COC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the COC website at www.facs.org/cancer to access the COC Educational Portal, Best Practices Repository, and Cancer Forum.